Safiya and I'm speaking on behalf of Nate Ford. As one of the spokespersons for the Nate Ford campaign, I am glad to say that we as a campaign are for free healthcare. Every year in the United States, about 45,000 preventable deaths occur because of the lack of people having healthcare. In the U.S., over 50 million people are uninsured. As a country, we should progress, not regress. In terms of universal health care, it is my opinion that health care coverage should be a right for all. All Americans have the right to health care as do citizens. All Americans should have the right to health care as do citizens of other nations. The United States is the only developed nation in the world that does not guarantee health care coverage for its citizens. According to the U.S. Constitution, health care is a right for all Americans. The U.S. Constitution states its purpose to promote the general welfare of the people. Providing all citizens the right to health care is good for economic productivity. Access to health care allows people to live healthier and longer lives, which in turn allows them to contribute to society for a longer time. The cost of bad health and shorter lifespans of Americans suffering from no insurance amounts to $65 to $130 billion annually of cost, loss of productivity. Healthcare costs are unaffordable and bankrupting Americans. Statistics show that in 2007, 62.1% of all U.S. bankruptcies were caused by medical expenses, and of those, 78% were filed by people who had medical insurance. In the current private healthcare system, the cost of premiums are rising very fast. Since 2000, cost of health insurance premiums have trebled faster than wages. The current President Obama has stated in his speech to the AMA on June 15, 2009, make no mistake, the cost of our health care is a threat to our economy and is escalating burden to our families and businesses. It is a ticking time bomb for the federal budget and is unsustainable for the United States of America. The two main arguments for free health care are the current and rising costs of the current private system and the overall health of the nation declining. The current system is not working. Those who oppose free health care are mainly those who currently benefit from the private of healthcare. They may falsely argue that healthcare for all would diminish the quality of healthcare in the U.S., that it would flood the system with new patients so that seeing a healthcare professional would become more difficult in a timely manner, especially since there is a shortage of healthcare professionals in the U.S., that it is a form of socialism and is bad for economic productivity and strive for excellence, innovation, and achievement in healthcare, that it would increase government spending and increase taxes for most Americans. These are reasonable arguments, but the fact still remains that our current system is not working, only seems to be getting worse as the years go by. With healthcare reform, the entire healthcare system has a chance to change. Someone I know went to work one day. While at work, he got into an accident. He sawed off two of his fingers. Unfortunately, his job didn't cover his medical insurance and couldn't afford it on his own. To get his fingers reattached, it would have costed him about $72,000, $12,000 for the ring and $60,000 for his middle. Sadly, he can only afford his ring finger. We live in a country where there is a price on the human body. There are many of us who are fortunate enough to be blessed with good health and to be able to afford health care. What about those of us who can't? Nate Ford for President 2012, and less about me, more about you. Yeah. And next up is Alicia Brown.